start. So this is the last time we had a session on the important questions on the autonomic nervous system. Now there are so many questions. Okay, I will. Let's first do this. Prodrug. Good evening, Rajiv. Rohit, prodrugs are the drugs which are inactive as such. जो बाहर मिलता है आपको, that is an inactive form, and once they're inside your body, they get metabolized into the active form. So those are prodrugs, like levodopa gets activated into dopamine, right? So that is a prodrug. So prodrug है ना, drug बाद में बनती है. It's a pro form, and active form तब बनता है when it is inside your body. So let's first concentrate on the topic which I have kept for today. Very important questions of the autonomic nervous system. This is second part. First few questions discussed in the live session last time. And again, there are some more questions which have been asked time and again in the various competitive examinations. So we'll be doing those questions, multiple choice questions, and I'll be explaining what are the important things which you should know from that particular topic. As I already told you last time, that sirf when we are practicing MCQs doesn't mean you're only doing the ratta of the question, which is the MCQ. It means that topic which has been asked is important, and us topic ke around you should be knowing everything else. Because one thing they've asked from this particular topic this time, so kuch uske bare mein dusra kuch pooch sakte hain next time. So that topic is supposed to be important, right? So let's start. ANS, very high yielding topic because many questions are asked on that. And so let's start with the first question for today. Autocoids, maybe I have a session and then, because aise beach mein if I talk about autocoids and everything, so nothing is going to be very clear because I've actually targeted this session just for an ANS. So if you want to have session on autocoids, I'll prepare actually certain questions because that is more important. What is important to learn there? तो उसमें बहुत कुछ आता है, histamine, serotonin, prostaglandins, important things. So I will take up autocoids ka session maybe next time. I'll discuss certain questions on that, and then I'll tell you what is important to know about those autocoids, right? So let's start with the first question and participate as much as you can. You know the answer, well and good. Do not know the answer, at least attempt to answer. There is no negative marking here. कोई गलत कुछ नहीं होने वाला यहाँ पे. It will just enhance your confidence to attempt questions. ठीक है? So let's see the first one. So please listen. Beta 2 receptors act via. Beta 2 receptors act via. Option number 1 is phospholipase C. Option number 2 is adenylyl cyclase. Option number 3 is tyrosine kinase. Option number 4 is phospholipase D. Beta 2 receptors act via phospholipase C, adenylyl cyclase, tyrosine kinase या phospholipase D. What is the correct option out of them? Rohit says adenylyl cyclase. All right. User Miss says 2, adenylyl cyclase. All right. Rajiv says tyrosine kinase. Okay. Any others? Anybody else who wants to guess or who wants to answer? Beta 2 receptors act via. So, yes, they act via. So, Rohit and user Miss said you are absolutely correct. So, Rajiv, it is not tyrosine kinase. It is adenylyl cyclase. Okay? So, it is adenylyl cyclase through which they act. तो ये जो G protein coupled receptors हैं basically, they are very important, and in exams it is asked sometimes which are the receptors which act via G protein coupled receptors. ठीक है? So if you have a notepad or something, I'll give you a list of receptors which are important, and you can write down the GPCR or G protein coupled receptors. So 3 type of G protein coupled receptors are important. One is the GS type, yes. One is the GI type, and one is the GQ type. जो GS type है, that functions via adenylyl cyclase. It stimulates the adenylyl cyclase. Hi Ahir. And GI जो है, वो इसके opposite होता है. So अब GI inhibits the adenylyl cyclase. So GS and GI are opposite. ठीक है? GS is stimulatory, I means inhibitory. So GS stimulates the adenylyl cyclase and increases the cyclic AMP, while GI inhibits that adenylyl cyclase, so it will decrease the cyclic AMP. while GQ जो है it functions via different messenger and that is your phospholipase C. It increases or stimulates the phospholipase C and it works via IP3 and DAG mechanisms. Right? That is one thing that you should know. Now, what are the different receptors which act via these GS or GI or GQ? जो कुछ important वाले हैं, जो GS में आते हैं. So you can write down GS में कौन से आते हैं? All beta, beta 1, beta 2, beta 3. They are all are GS type. ठीक है? G stimulatory type. Then 5-HT4, 5-HT4. Then H2. ठीक है? H2. Then dopamine type 1, dopamine D1. These are few important receptors which work by GS mechanism. So beta 1, beta 2, beta 3, H2, 5-HT4 and dopamine 1. They all work by GS mechanism. Now let's go to GI mechanism. GI mechanism में we have alpha 2, ठीक है? Alpha 2, M2. Basically जो auto receptors होते हैं which are usually presynaptic. They are usually of GI type. So alpha 2, M2, muscarinic type 2 receptors, H3, right? H3, histamine type 3, 5-HT1, 5-HT1 and D2. ठीक है? D2. They all work by GI mechanism. Then GQ. GQ is alpha 1. ठीक है? GQ is alpha 1. Muscarinic type 1, type 3, type 4, type 5. Except M2, all are GQ type. And they usually cause smooth muscle relaxations. So इसीलिए M3 जो आप बात कर रहे हो, ठीक है? So M3, beta 3, yes, beta 3 are now found on the bladder. So इसलिए जो Myra Begron है, that's a new drug which has agonist at beta 3 receptors. ठीक है? So GQ में मैं बात कर रही थी all the muscarinic M1, M3, M4, M5 except M2 are GQ type. Then alpha 1, H1, ठीक है? Alpha 1, H1, 5-HT2. So these are your GQ. So sometimes the question is asked, this receptor acts by which mechanism? So ये कुछ important receptors है जो पूछे गए हैं. So you can make a list of these receptors. ठीक है? Tyrosine kinase receptors, the most important example is your insulin. Insulin receptor works via the tyrosine kinase receptor. So that is the most important over there. So please remember, these are the G protein couple receptors. Very, very important. G protein, बहुत important है. Alright, so this is the list that you can get. If you have a notepad right now, you can make notes, or else once this video is uploaded, you can just go back and make a list of these receptors which work by these mechanisms. Please, very important to note. So let's go to the second question now. Hi, Ahir. Anticholinestrases are ineffective against. Anticholinestrases are ineffective against. Number 1, belladonna poisoning. Number 2, carbamate poisoning. Number 3, post-operative ileus. Number 4 is cobra bite. Anticholinestrases are ineffective against belladonna poisoning, carbamate poisoning, post-op ileus or cobra bite. So which is the correct option? Ineffective. कहीं इनमें काम नहीं करते. Which is the option जिसमें anticholinestrases हम नहीं देते? Yes. User misses belladonna poisoning. Okay. Anticholinestrases की बात कर रही हूँ. ठीक है? Anticholinestrases का मतलब है drugs like pysostigmine, neostigmine, ये सारी drugs हैं. Post-op ileus, post-operative ileus मतलब when after an operation the abdominal muscles become very lax. ठीक है? So just to increase the contraction, to get back the contraction and all, so we can use that because of the use of drugs and all that. Okay, Rajiv says post-op ileus और ineffective है मतलब वहां यूज नहीं हो रहे हैं. तो इसके लिए आपको पता होना चाहिए कि anticholinestrases यूज कहाँ होते हैं. So what are the uses of anticholinestrases? If you know that, you can just then tick mark कि कौन सा यूज नहीं है इसमें. Belladonna poisoning, carbamate poisoning, post-op ileus, and cobra bite. Or anybody else? कहाँ यूज नहीं होता? Okay, let's do this question by this. Okay, tell me which drug is used for management of belladonna poisoning. और अगेन आई सेड लास्ट टाइम भी मैंने कहा था, अभी भी मैं कह रही हूं कि जो 4 एम्डोलासिस 4 इज कोब्रा बाइट. ओके, एंटीडोट्स आप एक लिस्ट बना लो, लिस्ट ऑफ द ड्रग्स एंड देयर एंटीडोट्स. 1 या 2 एंटीडोट्स हमेशा एग्जाम में आते हैं, एटलीस्ट फ्रॉम फार्मा तो आते ही आते हैं. बाकी सब्जेक्ट्स में अलग से, बट फार्मा में 1 2 लास्ट टाइम तो 3 एंटीडोट्स. सो इट इज वेरी इंपॉर्टेंट. सो बेलाडोना पॉइजनिंग का एंटीडोट क्या है? व्हाट इज द ट्रीटमेंट फॉर बेलाडोना पॉइजनिंग? And then let's come to the answer that ways. You know, belladonna contains, the plant contains, belladonna plant contains, it is like, the name is Atropa belladonna. तो उसमें atropine होगा. ठीक है, तो उसमें atropine होगा. Yes, physostigmine is the treatment for belladonna poisoning. So definitely physostigmine एक anticholinesterase है. So belladonna poisoning तो आंसर यहाँ नहीं हो सकता. ठीक है, हमने पूछा है ineffective किसमें होगा, in which it should be ineffective. दतूरा, या दतूरा हो गया, बेलाडोना हो गया, इट इज द सेम. ठीक है, सेम. नंबर 2 ऑप्शन था इसमें कार्बामेट पॉइजनिंग. नाउ कैन यू टेल मी विच ड्रग वी यूज इन कार्बामेट पॉइजनिंग? कार्बामेट पॉइजनिंग में कौन सी ड्रग यूज करते हैं? कार्बामेट इज जस्ट लाइक ऑर्गेनोफॉस्फेट पॉइजनिंग. ठीक है, सो इट इज जस्ट लाइक ऑर्गेनोफॉस्फेट पॉइजनिंग. सो द ड्रग ऑफ चॉइस विल रिमेन द सेम in both. Drug of choice remains the same in both. No, it is not the antidote. Antidote पूछ रही हूँ. What is the antidote for carbamate poisoning? No, it is not the antidote. Which drug is the antidote for carbamate poisoning? Okay, organophosphate poisoning है which is the antidote. Organophosphate में. No, nobody has an idea. Organophosphate में कौन सा एंटीडोट यूज होता है? Organophosphate में होता क्या है? See, they are actually irreversibly binding to the enzyme which is acetylcholinesterase. So when they bind to the enzyme acetylcholinesterase, they will not allow acetylcholine to get metabolized. So body में acetylcholine levels are going to go high, and all the problems are going to be because of increased acetylcholine levels. Because acetylcholine acts, and these problems because acetylcholine acts on the muscarinic receptors as well as the nicotinic receptors. But the most troublesome symptoms are because of the muscarinic symptoms. So we should give a drug which will block the muscarinic receptor. So which drug blocks the muscarinic receptor? Or which is the competitive antagonist at the muscarinic receptor? It is atropine. Atropine. So atropine is your drug of choice or antidote of choice in case of organophosphate poisoning and also carbamate poisoning. तो डिफरेंस इनकी ट्रीटमेंट में सिर्फ ये है, जो कोलिनेस्ट्रेज रीएक्टिवेटर्स होते हैं लाइक प्रालिडॉक्साइम, दैट कैन नॉट बी यूज्ड इन कार्बामेट पॉइजनिंग, दे आर ओनली फॉर ऑर्गेनोफॉस्फेट पॉइजनिंग. Yes, user, atropine. So atropine is the drug of choice for carbamate poisoning. So therefore anticholinesterases are not used here, because anticholinesterase अगर आप यूज करोगे तो ये ऑलरेडी anticholinesterase poisoning की वजह से ही है. All this is because of anticholinesterase poisoning. So if you are going to use anticholinesterase, it's going to aggravate the condition. So they are not used in this. The third option was post-operative ileus. Yes, these drugs are used in post-operative ileus. And number 4, cobra bite में भी use करते हैं. Now, important to know, as I said, are the uses of your anticholinesterase drugs. Especially, let's talk about like neostigmine, the peripheral effects, because neostigmine is one drug. Assalamu alaikum, Umar. So neostigmine is one drug which is a quaternary compound, right? Quaternary compound, and it cannot cross your blood-brain barrier. So whatever in areas we are using neostigmine, it is only in the periphery. So what are the important uses of this drug? So there are two important uses. One is where it acts on the muscarinic receptors and the second is where it acts on the nicotinic receptors. So इसके uses, important uses हैं post-operatic paralytic ileus and post-op urinary retention. And in दोनों areas में the action is on the muscarinic receptor. Remember, the action is on the muscarinic receptor. और जहाँ nicotinic receptor पे इसने act करना है, जहाँ पे the action कौन से uses हैं? Very important is your myasthenia gravis. Number 2 is your cobra bite. And number 3 is reversal of your neuromuscular blockers. So these three are the uses, but where it acts on the nicotinic receptors. So very important to know what are the uses of anticholinesterases. So इसमें एक चीज और ध्यान में रखनी है कि हम कहीं जगह पे नियोस्टिग्मीन के साथ एट्रोपिन को कंबाइन करते हैं and in some uses we do not combine with atropine. So wherever we want to inhibit the muscarinic receptors, we give atropine and then we give neostigmine. So in all the uses which I have described under the nicotinic action, we have to give atropine because action is only desired in the on the nicotinic receptors, not on the muscarinic receptors. Muscarinic receptors would lead to the side effects. So muscarinic actions like effect on the post-op ileus or post-op urinary retention, we do not require atropine, while the nicotinic actions which is on the myasthenia gravis or cobra bite or reversal from the neuromuscular blockers, they require atropine. Very important difference, right? So these are the important uses of neostigmine or anticholinesterases. So जो you जहाँ पे use नहीं, myasthenia, yes, myasthenia में also you require atropine because the action is required at the NM receptors only. ठीक है, there is weakness of the NM receptors. Or autoantibodies are generated against the NM receptors. But you do not want any muscarinic action, right, of the acetylcholine when you're giving this neostigmine. Therefore, क्या है? Okay. ठीक है, so therefore you require this thing, right? So this is important to know the uses of anticholinesterases and where you want to give atropine along with it and where you do not have to give atropine. So again, very, very important. Let's come to the third question is, atropine poisoning causes all except. Atropine poisoning causes all except. Yes, it is autoimmune. Dilated pupil, excitement, excessive salivation, hot skin. Atropine poisoning causes all except dilated pupil, excitement, excessive salivation and hot skin. So atropine poisoning में what doesn't happen out of these? Yes. What does not happen in atropine poisoning out of these? Dilated pupil, excitement, excessive salivation or hot skin. So you need to know the adverse effects of atropine here. Which of these is not an adverse effect of atropine? Hallucinations, okay, they do occur at high. 4 is hot skin. Okay, Amdullah says hot skin. Umar Farooq says hot skin. Excitement, okay. Or anything else? Restless excitement, hallucination, delirium, coma. Does it cause or it does not cause? This is what atropine causes, Mr. Ayush, or do you think it is not there? See, very simple one thing you remember if you don't even know. See, इसमें बड़ा if you know the actions of acetylcholine, you can make out atropine उल्टा करेगा, ठीक है? It's going to do everything in opposite direction. So, if you see the important adverse effects of atropine, which you should know at any given point, one is हम क्या कहते हैं जब organophosphate poisoning हो रहा होता है and you are starting to give atropine, what do you look for? Signs of atropinization, right? We say that look for signs of atropinization. So, what do you look there? The size of pupil starts increasing. Yes. So that means atropine वो cause करता है. ठीक है? Then second thing, you see the mouth mouth becomes dry. ठीक है, because atropine causes decrease in all the secretions of the body. ठीक है, the third thing is tachycardia, the pulse starts rising. ठीक है, तो all these things are seen because of atropine. ठीक है, तो टॉक्सिक में तो और ज्यादा हो जाएगा. एट्रोपिन वो तो स्मॉल है, अगर टॉक्सिक दोगे, yes, so you're right, Mr. or whatever you've written, restlessness, excitement, they are all in toxic doses of atropine. So that means excitement is a part of atropine overdose, right? Hypothermia is a part of atropine overdose. Why? Because it decreases the sweat in the body, that is decreased. So you know what does sweating do normally? जब आपको sweating होती है उसके बाद it cools the body. किसी को जब sweating होती है क्या होता है? Body gets cooled. So when there is no sweating, there will be no cooling. So the body will get hot or there will be hypothermia. ठीक है? So that will be there. That's why बच्चों में we don't give atropine because of this problem, hypothermia. So hot skin does occur in atropine poisoning. ठीक है? Pupils dilate does happen in atropine poisoning. So the only thing which does not happen is excessive salivation. Rather the opposite happens. There is decrease in the salivation. Okay? So please note, these are very important points, and most of the questions when they are asked, these days they are not very straightforward. What does it do? No, they ask you what it does not do. Okay? So you have to rule out. अगर आपको डायरेक्ट आंसर नहीं पता तो जो बाकी ऑप्शंस हैं, यू हैव टू रूल आउट कि वेदर दिस इज कॉज्ड बाय दिस, वेदर दिस इज कॉज्ड बाय दिस, वेदर दिस इज कॉज्ड बाय दिस. ठीक है, सो दोज काइंड्स ऑफ थिंग्स. डायलेटेड प्यूपिल खुद ही करेगा बिकॉज यू वोंट बी एबल टू सी प्रॉपरली, राइट, if there is like photophobia. So excessive salivation is the correct answer here. Atropine में excessive salivation नहीं होता. Atropine में there is decrease in the salivation, dryness of mouth. That is the hallmark of atropine. So this is the option here, right? So और क्या चीजें इसमें important है atropine में? Apart from this are the various uses of atropine or its substitutes. So you can tell me what are the various uses? They are very important. Various uses of atropine. बता सकते हो? और its substitutes क्या क्या है? All the important uses. Very important to know. Uses of atropine. The first हमने एक आध बात किया है, it is as antidote in the organophosphate poisoning. That is one important use. Anything else? कहाँ पे use होता है? Other important uses of atropine. One is organophosphate poisoning. Already we have discussed. It's an antidote over there. The second, what are the other uses of atropine? Or its substitutes, मतलब और जो बाकी इसके हैं. Let's say eye में क्या use है? Atropine or its substitute. Eye में. It's an important MCQ. Do we use atropine in children for the eye refraction testing के लिए? हम बच्चों में use करते हैं atropine for refraction testing in the eye. Do we or do we not? In children. Okay, Parkinsonism में we don't use atropine. We use centrally acting anticholinergics, the ones which can cross the blood-brain barrier. ठीक है, biperidine, procyclidine, but atropine नहीं use करते. What about overactive bladder? Very very important. Overactive bladder में, so you remember the overactive bladder जो भी होता है, increased frequency होती है वहाँ पे. So there we use atropine, not the drugs which work like atropine basically. So atropine substitutes. Mnemonic is soft bladder. ठीक है, soft bladder में use कर सकते हैं. Yes, they can cause this mydriatic in the eye. Yes, very good. So but not in adults. Heart rate, atropine से heart rate slow नहीं होता. Atropine is used in bradycardia. ठीक, cholinergic system heart rate slow करता है. Atropine will be causing tachycardia. So in cases of sinus bradycardia वगैरह वहां पे हम इसको यूज करेंगे. ठीक है, you remember sympathetic system increases the heart rate and जो cholinergic system है decreases the heart rate. और atropine is the opposite of the cholinergic system. So it will increase the heart rate. Yes, it's a cycloplegic. साइक्लोप्लीजिया, सो बच्चों में एक्चुअली बिकॉज देयर सीलियरी टोन बहुत ज्यादा होता है तो वहां पे एट्रोपिन यूज करते हैं, बट नॉट इन दी अडल्ट्स बिकॉज एट्रोपिन हैज अ हाफ लाइफ ऑफ अबाउट 1 वीक. अगर हम अडल्ट्स में यूज करेंगे 1 वीक तक दैट पर्सन वोंट बी एबल टू सी प्रॉपरली. ठीक है, सो इट इज नॉट रिकमेंडेड इन अडल्ट्स, इट इज नॉट यूज. वहां पे हम ट्रोपिकामाइड लाइक ड्रग्स यूज करते हैं विच हैव 4 to 6 आवर्स में उनका असर खत्म हो जाता है, नॉट टू बी यूज देयर. Then it is used in pre-anesthetic medications, especially like glycopyrrolate and जैसे atropine है, to decrease the secretions. Then it can be used in like tiotropium, not atropine, but tiotropium, ipratropium is used in bronchial asthma. ठीक है, it is used in bronchial asthma. Then, as you already said, that they are used for mydriasis, fundoscopy वगैरह. Then it can be used in, as I said, जो ओवर एक्टिव ब्लैडर में इंपॉर्टेंट ड्रग्स है, सॉफ्ट ब्लैडर का एक निमोनिक याद रखना है, SOFT, सॉफ्ट. S इज फॉर सोलिफेनासिन और एक दूसरी ड्रग है डारीफेनासिन. O इज फॉर ऑक्सीब्यूटाइनिन, F इज फॉर फ्लेवॉक्सेट, T इज फॉर टॉलटीरोडीन. So these are the drugs which are used for overactive bladder where there is enhanced or बार frequency or urinary frequency is increasing. That is there. ठीक है. So whatever the cholinergic, atropine is going to do the opposite in the heart, right? ठीक है, जो भी cholinergic का action है उससे उल्टा ही करेगा atropine. ठीक है, so yes, they can be used there. Now we have another here. Let's move out to the next. So I hope atropine के uses are important. Atropine कहाँ use होता है? Very antidote OP poisoning, very very important. और atropine के side effects, atropine as such is very important. If I said atropine poisoning is important और atropine के side effects हमने जितने भी किए, ठीक है, वो important है. Okay. Now the next question is the recently drug which has been approved for management of obesity, ठीक है, the recently approved drug for management of obesity along with phentermine is. So if you don't know, you have to remember these drugs, whatever. जो भी आप इसमें guess अगर आता है तो बहुत अच्छा, नहीं आता तो इसको रट्टा मारना है. ये भी पूछा गया काफी. Obesity, anti-obesity drug. So which is the recently approved drug which is used in the management of obesity along with phentermine? Options are number 1, lorcaserin, number 2, orlistat, number 3, sibutramine, and number 4, topiramate. ठीक है, ये 4 ड्रग्स हैं, lorcaserin, orlistat, sibutramine, and topiramate. Recently approved drug है ये, FDA approval मिली है in combination with phentermine to be used as an anti-obesity drug. So which is that? Dr. Ria says orlistat. Okay. Anybody else would like to try answering? Orlistat. Okay. Orlistat is definitely used for obesity, but यहाँ पे question है combination और वो अप्रूव हुआ है. सो ऑर्लीस्टैट कॉम्बिनेशन में है कि नहीं, ये हमने देखना है. ऑर्लीस्टैट डेफिनेटली यूज होता है एज एन एंटी ओबेसिटी ड्रग, इट इज देयर, बट यहाँ पे हमारा क्वेश्चन है इट इज अप्रूव्ड टू बी यूज्ड अलोंग विथ फेंटोमीन. ठीक है, ओके. राजीव ऑल्सो सेज ऑर्लीस्टैट, यूजर मिस सेज 3 इज sibutramine. ओके, any other guess or your option, any other response? Anybody would like to differ? All right, I'll tell you the answer to this question. So इसका जो आंसर है तो आप लिख लो, इसका आंसर है topiramate. ठीक है, topiramate recently approved हुआ है to be used along with phentermine for the treatment of obesity. See, topiramate is one drug. It is an anti-epileptic. So question था which drug is approved by FDA to be used in combination with phentermine for obesity. कौन सी drug? Again I can repeat, the drug which is recently approved to be used along with phentermine for the treatment of obesity is, the options were lorcaserin, orlistat, sibutramine, and topiramate. ठीक है, सो द करेक्ट ऑप्शन इसमें है टोपायरामेट. टोपायरामेट एक्चुअली एंटी एपिलेप्टिक ड्रग है, बट उसका उस केस में एक एडिशनल इफेक्ट था, साइड इफेक्ट, दैट इट यूज टू कॉज वेट लॉस. तो अब हमने वो पकड़ लिया उसका वेट लॉस वाला इफेक्ट एंड वी हैव पुट इट टू गुड यूज. Good use in the sense it was tried initially in the management of obesity, or it was seen it caused weight loss. तो इसको अप्रूव कर दिया FDA ने for management of obesity, and it is used, can be used in combination with phentermine. ठीक है. So now important list of drugs which are used for management of obesity. Number 1 is your liraglutide. It is a GLP-1 analog. You can write if you have a paper on pen. लीराग्लूटाइड वेरी इंपॉर्टेंट. ओबेसिटी पे भी एक आधा क्वेश्चन कई बार पूछते हैं बिकॉज ये सारे प्रीवियस ईयर क्वेश्चन ही हैं. सो लीराग्लूटाइड इट्स अ GLP-1 एनालॉग जो कि यूज करते हैं फॉर ओबेसिटी. देन कॉम्बिनेशन मैंने आपको ये बताया, फेंटरमीन फॉर प्लस टोपायरामेट. अनदर कॉम्बिनेशन एक यूज करते हैं जोनेसामाइड प्लस बुप्रोपियन. थर्ड ऑर्लीस्टैट. ऑर्लीस्टैट इज डेफिनेटली यूज्ड. इट इज अ ओरल लाइपेज इनहिबिटर. ना पहले हम सिबुट्रामीन भी यूज करते थे और फेनफ्लोरामीन भी यूज करते थे. नहीं, सीजर कभी सी इफ यू रिमेंबर एंटी एपिलेप्टिक ड्रग्स दे ओनली वर्क ऑन द एक्टिव कहते हैं. और ये सीजर कॉज क्यों करेगा? तो सीजर के ट्रीटमेंट में यूज हो रहा है ना, तो व्हाई विल इट कॉज अ सीजर? इट इज एन एंटी एपिलेप्टिक. और वैसे भी एंटी एपिलेप्टिक ड्रग्स जो होती हैं दे ओनली वर्क ऑन द न्यूरॉन्स विच आर हाइपर एक्टिव. नॉर्मल न्यूरॉन्स को डिप्रेस नहीं करते. हाइपर एक्टिव जो न्यूरॉन्स होते हैं जो फायर कर रहे हैं बार बार उनको उन पे करते हैं. और सीजर तब कॉज होगा जब कोई एपिलेप्टिक ड्रग होगी. दिस इज एन एंटी एपिलेप्टिक. ठीक है. और अच्छा, जो मैं अभी बोल रही थी कि जो नहीं यूज करते, सिबुट्रामीन, फेनफ्लोरामीन दोनों अब मार्केट में विड्रॉ कर ली गई हैं या इसका यूज कई जगह पे होगा, बट मोस्टली इट इज नॉट यूज बिकॉज इट हैड अ लॉट ऑफ कार्डियोटॉक्सिक साइड इफेक्ट्स. सो इसलिए अब इसको हम प्रेफर नहीं करते. ठीक है. सो दीज आर नॉट यूज. व्हाइल लीराग्लूटाइड इज यूज, टोपायरामेट इज यूज, देन ऐसे जोनेसामाइड भी यूज करते हैं, ऑर्लीस्टैट वी कैन यूज. ठीक है. सोडियम प्लस पोटेशियम साइड बाइंड करके क्लिक इन्फ्लक्स होता है. ये किसकी बात कर रहे हो आप? सेंसिटिव सोल्स. एंटी एपिलेप्टिक्स में हम बात करें तो पायरामेट हैज डिफरेंट एक्शंस. और एनी केस दैट इज अ डिफरेंट थिंग. इसका टोपायरामेट का इट वाज अ साइड इफेक्ट विच वाज देयर जो कि वेट लॉस का था, और अब हमने उसको एम्प्लॉय कर दिया है एज एन एंटीबेस्टी. सो ये इसका एंटी एपिलेप्टिक इफेक्ट है. सो दैट इज मोरली वो ये इफेक्ट आता है इन द न्यूरॉन्स. ठीक है. सो न्यूरॉन्स में हम ओवर एक्टिव जो ग्लूटामेट एक्टिविटीज को कम करते हैं बिकॉज ऑफ दिस इफेक्ट. तो एंटी ओबेसिटी. सो प्लीज ये लिस्ट ऑफ ड्रग्स है जो आपको पता होना चाहिए कौन सी ड्रग्स हम ओबेसिटी में यूज करते हैं और क्यों. जो एक दो ड्रग्स जो विड्रॉ हो गई हैं क्यों हो गई हैं? बिकॉज ऑफ कार्डियोटॉक्सिसिटी. सो अनदर इंपॉर्टेंट टॉपिक इज एंटी ओबेसिटी ड्रग्स. जोनेसामाइड इज ऑल्सो अ एंटी एपिलेप्टिक ड्रग. ठीक है. वो भी एंटी एपिलेप्टिक ड्रग ही है. बोथ टोपायरामेट, जोनेसामाइड, ये दोनों एंटी एपिलेप्टिक ड्रग्स हैं. Alright, let's come to another important topic which is your beta blocker. अब एक बीटा ब्लॉकर के बारे में क्वेश्चन है. Now beta blocker with ISA. ISA means intrinsic sympathomimetic activity is. So which of the beta blockers are the beta blocker which have an intrinsic sympathomimetic activity? Option number 1 is propranolol. Option number 2 is atenolol. Option number 3 is sotalol. Option number 4 is pindolol. ठीक है. Pindolol. So which of the ये चारों बीटा ब्लॉकर्स में से कौन सा बीटा ब्लॉकर ऐसा है जिसमें इंट्रिंसिक सिंपैथोमाइमेटिक एक्टिविटी होती है? प्रोप्रेनोलॉल, अटीनोलॉल, सोटालॉल, पिंडोलॉल. Yes. Tell me. Umar says propranolol. Propranolol has an intrinsic sympathomimetic activity. So intrinsic sympathomimetic activity means the drug has a partial or an agonistic activity at beta 1 receptor. ठीक है. ये मतलब होता है intrinsic sympathomimetic. Sensitive soul says propranolol. Okay. Rajiv says propranolol. Okay. Anybody else? So there's a mnemonic to remember beta blockers with intrinsic sympathomimetic activity. ठीक है, वो मैं अभी आपको दूंगी. So you will know कि कौन से beta blockers में intrinsic sympathomimetic activity होती है. Maybe atenolol. No, so it is pindolol. Pindolol में होती है. ठीक है. Now you write down, this is a mnemonic to remember the beta blockers with intrinsic sympathomimetic activity, not propranolol. याद रखो, इसमें एक लाइन अभी मैं बोलूंगी. सो कंटेन्स पार्शियल एगोनिस्टिक एक्टिविटी. ठीक है. सो ISA का मतलब ही है इट कंटेन्स अ पार्शियल एगोनिस्टिक एक्टिविटी. सो अगर आप ये लाइन याद रखोगे, कंटेन्स पार्शियल एगोनिस्टिक एक्टिविटी. अब इसमें से निमोनिक डिराइव करते हैं. जो कंटेन्स का C और O है, उसमें से देयर आर 2 ड्रग्स. सेलिप्रोलॉल, ठीक है, C इज फॉर सेलिप्रोलॉल एंड O इज फॉर ऑक्सप्रेनोल. ठीक है, ऑक्सप्रेनोलॉल. CO कंटेन्स C सेलिप्रोलॉल, O ऑक्सप्रेनोलॉल. पार्शियल कंटेन्स पार्शियल में P, दैट इज P इज फॉर पिंडोलॉल. एगोनिस्टिक A इज फॉर alprenolol and activity का A is for ace-butylol. ठीक है. सो कंटेन्स पार्शियल एगोनिस्टिक एक्टिविटी. सो ये आपकी ड्रग्स हैं जिनमें ISA है या बीटा ब्लॉकर्स विच हैव अ पार्शियल एगोनिस्टिक एक्शन ऑन द बीटा 1. सो इस जो जितने भी ऑप्शंस आई गेव यू उसमें से पिंडोलॉल फिट्स हियर. सो पिंडोलॉल इज द ऑप्शन विच इज करेक्ट. नाउ वन मोर थिंग टू रिमेंबर हियर इज जो ace-butylol है. ठीक है, इस पे भी एक क्वेश्चन आया था. लेट मी टेल यू अबाउट दैट क्वेश्चन. ace-butylol इज वन ड्रग which has 3 important. Last was ace-butylol. ठीक है, ace-butylol, alprenolol. ठीक है, ace-butylol, alprenolol. So ACE. So ace-butylol is one drug which has 3 effects. It has intrinsic sympathomimetic activity, it has a membrane stabilizing action and it is cardioselective. ये तीनों के तीनों features ace-butylol में है. Ace means ikka has a lot of good things about it. So इसलिए there was a question once in MCQ, which of the following beta blockers is cardioselective, has membrane stabilizing action, has intrinsic sympathomimetic activity. So ace-butylol is your answer to this. So please remember ace-butylol में 3 qualities हैं. So I've told you the mnemonic to remember for the beta blockers which contain the intrinsic sympathomimetic activity. Now there is another mnemonic if you want to remember for beta blockers which have a membrane stabilizing action. So membrane stabilizing action actually corresponds to its antiarrhythmic action. ठीक है. So इसका again the sentence is possesses membrane stabilizing and local anesthetic action. तो ये जो drugs हैं they have membrane stabilizing and local anesthetic action. Now how to remember? Possess. ठीक है, the first word was possess. इसमें the first P is for propranolol. They possess. मेम्ब्रेन स्टेबलाइजिंग का सिर्फ M लेना है हमने, दैट इज मीटोप्रोलॉल. लोकल एनेस्थेटिक में L लेना है पहले, दैट इज लबीटालॉल. एनेस्थेटिक का A लेना है, आई टोल्ड यू ace-butylol हर जगह फिट होता है. ठीक है. एंड पोजेस मेम्ब्रेन स्टेबलाइजिंग एंड लोकल एनेस्थेटिक प्रॉपर्टी. जो लास्ट वाला P है दैट इज पिंडोलॉल. आई विल रिपीट अगेन. So to remember which beta blockers have membrane stabilizing action, remember possess membrane stabilizing or local anesthetic property. So membrane stabilizing or local anesthetic property. तो possess का P, 1P is for propranolol. Membrane stabilizing में only the M is to be remembered, that is metoprolol. Local anesthetic में L you remember, L is for labetalol. Anesthetic का A is for ace-butylol and the last is property. Property का P stands for pindolol. So these are important beta blockers to remember, because then MCQ are asked which of the following possess membrane stabilizing action, which of the following possess intrinsic sympathomimetic activity, right? Which of the drugs has all the three, like cardioselectivity, ISA, MSA. ठीक है? So ये आपकी list of drugs हैं that you should mug up with this mnemonic, right? All right. Now, another important topic is your dopamine. Dopamine is also a very, very important topic to know. तो इसके बारे में आपको इसके receptor actions, इसकी dose is very important to know. MCQs में पूछते हैं. So let's have an MCQ which was asked about dopamine. Now, in shock, dopamine is used at which of the following rate? ठीक है? Condition है shock. Dopamine is used at which of the following rate? First option is less than 1 to 2 micrograms per kg per minute. Number 2 is 1 to 2 microgram per kg per minute. Number 3 is 2 to 10 microgram per kg per minute. Number 4 is more than 10 microgram per kg per minute. So shock में हम dopamine की कौन सी डोज यूज करते हैं? Less than 1 to 2, 1 to 2, 2 to 10 or more than 10? Yes. Try and attempt. Which of the following range हम कौन सा यूज करते हैं for shock? Dopamine का डोज. Yes, please. Less than 1 to 2, 2 to 10. Dolly says 2 to 10, okay? Sensitive soul says 1 to 2, okay? All right. See, shock में dopamine can be used in congestive heart failure. Rajiv says 1 to 2. As well as it is used in shock. But हमारा purpose different होता है दोनों में, ठीक है? जैसे congestive heart failure में हम यूज कर रहे हैं, our main aim is to increase the contractility of the heart, ठीक है? So वहां पे हम उस purpose के लिए यूज करते हैं. Shock में the main aim is to increase the blood pressure, right? So हम उस purpose के लिए यूज कर रहे हैं. Now, why the range of dopamine is important? Because at different dose ranges, it will act on different receptors and will give you different effect. तो हमें कौन सा effect we want for that particular condition, that or that drug or dose has to be used. So for you to answer this question, you should know at what range, what effect is caused, right? So remember, when you use a smaller range or lower range of dopamine, 1 to 2 or less than 2 basically, that will only affect the dopamine receptors in the kidney, okay? So in the renal area, renal blood vessels. So what it does is it increases the urinary output or urinary blood flow, okay? Or that is the main aim of low dose dopamine. जब आपको सिर्फ वो चाहिए urinary outflow increase करना, कि किडनी शट डाउन ना हो जाए, रीनल शट डाउन ना हो जाए, so that is your main aim. It is less than 2. Now, if you use it for a slightly higher dose, moderate dose में चले जाओ, 2 to 10, तब इसका क्या यूज होगा? It will definitely act on your dopamine receptors. तो वो जो first function था वो तो cause करेगा. Second, it will also start now acting on the beta 1 receptors. So beta 1 receptors, especially in the heart, what it is going to do, it is going to increase the heart rate. It is going to increase the cardiac force of contraction and the cardiac output. And contractility is also increasing. So हमारे को, that is the additional action we are getting at the moderate dose because of beta 1. So low dose only dopamine receptor, moderate dose also the beta 1 receptor. Now when you go above 10, that's normally we don't go above 10, higher doses, then it acts on the alpha 1 receptors and leads to vasoconstriction. Now what is vasoconstriction going to do? It is going to increase your blood pressure. ठीक है? This is the important thing here. So what dose are we using in what condition will depend on definitely the हमें क्या चाहिए. So कंजेस्टिव हार्ट फेलियर में मोस्टली वी आर कंसर्न्ड विद योर द रीनल शटडाउन ना हो जाए एंड यू वांट टू इंक्रीज द कार्डियक कंट्रैक्टिलिटी. सो डोज ऑफ 2 to 10 is sufficient over there. But shock पे the first thing we are going to do is we are going to increase the blood pressure of the patient. So in that case we need a vasoconstriction. So यहाँ पे the dose to be used is greater than 10. ठीक है, for this shock. Mainly the first aim is, otherwise CHF में we don't require. अगर हम वहाँ पे vasoconstriction करना शुरू कर देंगे so it will not allow the heart to pump the blood out. ठीक है, that is one thing. So important here, the question was in shock कौन सा dose use करते हैं? It is greater than 10. Remember, CHF में अगर आता heart failure में then it is 2 to 10. So please remember the doses of dopamine and what receptor. कई बार ऐसे आता है कि आपको एक्शन दिया होता है कि इट इज कॉजिंग द इंक्रीज इन द कार्डियक कॉन्ट्रैक्टिलिटी. सो व्हाट डोज ऑफ डोपामीन इज बीइंग गिवन? सो लेट्स से दैट इट इज बीइंग यूज्ड इन सीएचएफ. सो व्हाट इज द डोज ऑफ डोपामीन बीइंग गिवन? सो वहां पे आपको वो सिलेक्ट करना है. ठीक है. पार्किंसन डिजीज में कितना करते हैं? पार्किंसन डिजीज में डोपामीन वी डोंट यूज डोपामीन, वी यूज लीवोडोपा. ठीक है, लीवोडोपा यूज करते हैं हम. आईवी थोड़ी दे रहे बेटा उसमें, वी कांट गिव ओरली. ठीक है, वी यूज लीवोडोपा देयर. सो लीवोडोपा गेट्स कन्वर्टेड इनटू डोपामीन इन योर ब्रेन. पार्किंसंस में वी डोंट गिव डोपामीन डायरेक्टली बिकॉज डोपामीन ब्लड ब्रेन बैरियर क्रॉस नहीं कर सकता. ठीक है, सो अगर आप बाहर से दोगे डोपामीन तो वो सारा का सारा बाहर मेटाबलाइज हो जाएगा. इट वॉन्ट रीच योर ब्रेन. So that's why you cannot give dopamine directly. You have to give a drug which crosses the blood-brain barrier and then it converts into dopamine over there. So that's why levodopa is a pro-drug. Iska active form is dopamine. So you give levodopa, not dopamine directly for Parkinson's disease. Alright, so last question of the day. And again, it's a very important topic. This is clonidine is used for. Clonidine is used for. And this time in NEET PG, there was a question on clonidine. Okay? So clonidine is used for number 1, migraine, number 2, opioid withdrawal, number 3, diabetic diarrhea, number 4, all of the above. ठीक है, so number 4, all of the above. Clonidine is used for migraine, opioid withdrawal, diabetic diarrhea, all of the above. So there are some clonidine use अब कम करते हैं for its actual use. There are some off-label uses of clonidine. तो उसके लिए कई बार लोग clonidine use करते हैं. Though it's not a very popular drug, but it can be used. So clonidine was initially used for. So पहले हम ये बात करते हैं clonidine use कहाँ करते हैं actually. Clonidine is used for हाइपरटेंशन. अब आप एंटी हाइपरटेंसिव की बात करेंगे. इट इज अ अल्फा 2 एगोनिस्ट, सेंट्रली एक्टिंग अल्फा 2 एगोनिस्ट, बट बिकॉज ऑफ द डेंजर ऑफ रीबाउंड हाइपरटेंशन अब क्लोनिडीन इज नॉट प्रेफर्ड मच. ठीक है, सो इस क्वेश्चन का आंसर इज ऑल ऑफ द अबव. सो आप जितने भी क्लोनिडीन के यूजेस हैं ऑफ लेबल यू शुड नो. ठीक है, सो एक तो है हाइपरटेंशन इज द FDA अप्रूव्ड यूज. ठीक है, माइग्रेन में भी एक्चुअली इसमें दे हैव ट्राइड इट, तो ऑफ लेबल है, अप्रूव्ड यूज नहीं है इसका. ठीक है, ऑफ लेबल है. दो आई एम सेइंग इट इज नॉट अ वेरी पॉपुलर ड्रग फॉर एनी ऑफ द कंडीशंस आई एम टेलिंग यू, स्टिल इट इज डॉक्यूमेंटेड इन एरिया. तो जो इसका एक्चुअल यूज हाइपरटेंशन, जो कि अगेन इट्स अ वेरी रेयर यूज, इट इज नॉट यूज्ड, वेरी रेयरली इट इज यूज्ड. ऑफ लेबल यूजेस में प्लीज राइट डाउन द ऑफ लेबल, दो इट इज गिवन इन द बुक्स ऑल्सो, बट इफ यू वांट टू राइट डाउन द ऑफ लेबल यूजेस, it is used in opioid withdrawal, it is used for alcohol withdrawal, it is used for smoking cessation, just to decrease the sympathetic activity, because जब आप कुछ withdraw कर रहे हो it increases the sympathetic activity in the body. So it is used in opioid withdrawal, it is used in alcohol withdrawal, it is used in smoking cessation. These are all off label, कोई approved use नहीं है. Then it has been found to have an analgesic action. ठीक है, so it can be used along with morphine for epidural analgesia. Number 3, it has been found to be effective to treat hot flashes in menopausal women. ठीक है, that is another use. Then it can be used in diabetic, let's say diabetic diarrhea कहते हैं जिसको, diabetic diarrhea, because it leads to retention of salt and water, and ADHD, I hope I'm visible. I think something went off. ADHD, Tourette syndrome, ठीक है? ADHD, Tourette syndrome, mania, ये सारे इसके ऑफ लेबल यूजेस हैं. तो कई बार क्वेश्चंस आते हैं ऑन दी ऑफ लेबल यूजेस. सो आई रिपीट, क्लोनिडीन, ठीक है? क्लोनिडीन के ऑफ लेबल यूजेस: ओपियाइड विड्रॉल, अल्कोहल विड्रॉल, स्मोकिंग सेसेशंस, treating menopausal hot flashes as an analgesic along with morphine. Then it has been tried in diabetic diarrhea, then ADHD, Tourette syndrome, mania. So ये सारे off label uses है. It doesn't mean that it is widely used in these conditions. ये इसके ऑफ कई बार ट्राई करते हैं कुछ लोग, दे हैव बीन, कुछ लोगों को इफेक्टिव लगता है, बट इट हैज अ लॉट ऑफ साइड इफेक्ट्स, तो इसका यूज बहुत पॉपुलर नहीं है. बट बिकॉज एग्जाम में समटाइम्स दीज क्वेश्चंस आर आस्क्ड, सो आई एम टेलिंग यू दी ऑफ लेबल यूजेस कि अगर ये आएगा सो यू कैन टिक दैट दीज आर द ऑफ लेबल यूजेस ऑफ क्लोनिडीन. आपने सिर्फ ये नहीं सोचना कि क्लोनिडीन ओनली इज वर्क यूज एज अ एंटी हाइपरटेंसिव ड्रग. इट हैज सम अदर यूजेस विच आर नॉट अप्रूव्ड बाय द FDA, बट the practitioners have found this drug to be useful in certain conditions, तो वहां उसको यूज करते हैं, बट अप्रूवल नहीं है इसका, ठीक है? इसको हम कहते हैं ऑफ लेबल यूज. इट इज नॉट द लेबल्ड यूज. सो दीज आर द इम्पोर्टेंट क्लोनिडीन के यूजेस, राइट? सो दीज वर द इम्पोर्टेंट क्वेश्चंस जो कि हैव बीन आस्क्ड from ANS in the previous exams. So see if you go back to this, जो topics मैंने mention किए हैं which I have taken from, so go around those topics and see what जो भी important things है, highlight them and make notes of them. Again I'm saying antidotes are very important. Antidotes हमेशा आप एक अलग list बना के रखो, because that is very very important. पूछते ही पूछते हैं. Then dopamine, which I discussed, another important drug which is asked, the uses of dopamine at different concentrations, जो different dose concentrations में उसका क्या effect है on what receptor and where it is used. Then beta blockers में, apart from the uses of beta blockers, I have not discussed that today, the importance of which beta blocker belongs to the class which has intrinsic sympathomimetic activity, which has membrane stabilizing action, and which are cardioselective as such, those also. Then last time also हमने belladonna poisoning किया था, organophosphate poisoning किया था. कौन सा contraindication है, क्यों, why, what is the difference in the treatment of organophosphate carbamate poisoning, that we don't use cholinesterase reactivators in carbamate poisoning, while we can use them in organophosphate poisoning. Then clonidine, I discussed the important rebound hypertension as a drawback with clonidine. It was asked recently in the exam. So rebound hypertension with clonidine, it is very important to know. And what are the other off-label uses of clonidine? Then obesity के लिए, what are the drugs which have been approved for management of obesity, and which anti-epileptic actually is used? So these are especially the topiramate is the most popular drug, and then even zonisamide, they can be used. So these are certain points which are important to know, and you can highlight them or write them in your notes which you're making, so that you don't miss out on these important things, right? So that's the whole process, or that's the whole reason for doing the PYQs or the MCQs. So you know कि कौन से topics में से ज़्यादा questions आते हैं, and that is what you should be focusing more on when you're preparing for your exams, right? So if there is any other, like I'll be mostly taking up another topic or another section and discussing MCQs on that. ठीक है? PCOD से बनाए, ओके, मेटफॉर्मिन. एक्चुअली PCOD से इट्स मोर ऑफ अ गाइनी क्वेश्चन, बट उसमें मेटफॉर्मिन यूज होता है. यू कैन सी दैट वन ऑफ द ड्रग्स इज मेटफॉर्मिन. अदरवाइज ये मोस्ट ऑफ ऑब्स गाइनी क्वेश्चन है एक्चुअली. विच ऑफ द ड्रग इज यूज फॉर द मैनेजमेंट ऑफ PCOD? ठीक है, ओके, आई विल पुट वन क्वेश्चन. यूजली मेटफॉर्मिन यूज होता है. आई विल सी. PCOD अकेला इज नॉट अ वेरी बिग टॉपिक फॉर फार्माकोलॉजी एज सच, ठीक है? So let's see if I can fit it into, like, maybe when we do endocrine में हम ये कर सकते हैं कि endocrine pharmacology, like I already have discussed this before, endocrine pharmacology, but I'll try to post a question on PCOD, because ये एक या दो ही question आते हैं PCOD में, that is drugs for PCOD you can say, ठीक है? So I'll see the next time I will take more questions which have been asked in the previous years, and we'll discuss them next time, okay? So thank you so much for joining, everybody, and I'll see you next time. Till then, take care, have a great weekend, and keep studying and enjoying.